Dr. Robert, is knee pain during squats normal or harmful?
Especially after surgery, it's very common.
It can heal on its own. One exercise every athlete should do for the knee health.
No matter what age you are, the stronger your quads are, my pill is that they have to work out, and that can lead to long-term problems. The biggest mistake is not doing.
Hello audience. So today I'm joined by none other Dr. Robert LaPrade, one of the world's leading knee surgeon and a global authority on complex sports knee injuries. With over 30 years of clinical experience and academic work with 300 plus peer-reviewed literature, Dr. LaPrade has worked in shaping and understanding ACL injuries, meniscus pathologies, and knee biomechanics, and helping the long-term knee preservation understanding. Also, this conversation is especially for the athletes, fitness enthusiasts, young people who want to protect their knees and stay active for their life. Hello, sir. Welcome to our show. And I'm enlightened and deeply honored that you accepted our invitation for this small chat. And let's proceed with our first question. That is the most common questions that are asked or searched online. Is knee pain during squats normal or harmful? How do you answer that?
Well, I think it's hard just to generically answer something like that because you have to help localize it. Is it in the front part of the knee, which could be kneecap problems, or is it the back part of the knee where you're worrying more about a meniscus tear or a Baker's cyst? So when a patient tells me that they have pain when they squat, I want to know where the pain is, because then it can help me to guide them in terms of what may be going on.
So basically it depends on the pathology also and the location of the pain.
Correct. The location of the pain is important to help figure out, because then you can maybe start to have your brain thinking about what the next step may be, what your next question is, and and how to help hone in and what we can do to try to help them.
So knee clicking, the pain that comes while bending the knee, it causes a lot of anxiety online. When should athletes worry and when should they ignore it?
So it depends upon what else is going on in the knee. Non-painful clicking is common after surgery because people have swelling and the quadriceps muscles will be a little weak. If somebody has a little bit of arthritis, the lubrication in their joint isn't normal, so they can have clicking when they sit down and first get up from a chair upon arising, or they can have it when they're just getting up early in the morning. So it's important to figure out when that occurs. If they have clicking that is with certain maneuvers, especially where it's along the joint line, then we'd be more worried about investigating that further and seeing if it's something that needs an MRI scan or x-rays or something else to help us hone in on what the diagnosis is.
To summarize this, if it's a non-painful clicking, then it shouldn't be a worrisome problem. But if it's painful, then we need to further investigate it.
Correct. Non-painful clicking isn't something that I get worried about, especially after a surgery. It's very common.
Right. If a patient has an ACL tear and his friends and family and the people nearby around him telling him it can heal on its own, what advice would you give?
Well, I mean, the issue is that once the ACL tears, it's low likelihood it's going to heal on its own. There are some that are certain areas that the ACL may heal back, but that's pretty rare. So I think it's a matter of trying to talk to a professional about it and don't rely on Dr. Google or your family for a diagnosis, because early treatment is important. If you have an unstable knee and you try to play sports on it, you can cause some permanent damage. So at least having a correct diagnosis, because there are times that we'll see an ACL and it looks bad on the MRI and the exam isn't so bad. So we may try some physiotherapy or bracing, but there's other times that it's pretty clear that their knee is very unstable. And if they try to keep playing sports or other activities, it can cause meniscus tears and arthritis. So it's a matter of examining the patient and putting it all together.
Moving ahead in this line, what is the single most biggest myth revolving around ACL that athletes face and they encounter and when they meet you, or in your experience, the one single biggest myth around ACL?
I don't know if I could say there's one single myth. I think it's important to make sure that the patient has a correct diagnosis.
Right.
Because when I see someone with an ACL tear, it's common that a medial meniscus tear, which we call a ramp lesion, was missed, or a lateral meniscus root tear, or maybe their slope was increased, or they have extra heel height, which means that they're hyperflexible. And all those things can make a difference in what graft you recommend for a patient and what type of rehabilitation and other surgeries. So that's probably the biggest myth that I see when somebody comes to see me. It's not so much is their ACL torn or not, because a lot of times they have that diagnosis. It's a matter of what else is going on, so you don't mess up the first surgery and give them the best chance of having a good knee.
Right. So if someone, a player, especially a player in a competitive state, and if he has a meniscus tear already diagnosed, should he continue playing, taking the risk, or should he just get it evaluated and get it treated first and then resume playing after a proper rehab?
So I'm known as the meniscus saver for the professional leagues in the US because I always push an athlete to get it repaired.
Right.
I feel that a 20-year-old man is going to be wanting to coach or play with his kids in the future and have an active lifestyle. And if you have your meniscus taken out so you can play, it's very short-sighted, because we know that most of the time when you have your meniscus taken out, you're shortening your career. But also, when you're done with your career, the next 50, 60 years of your life, you want to be able to have the ability to function at the highest level possible. So I usually tell them they should fix it, take time. There may be some rare indications where financially they have to take it out, but I think you have to look at the whole picture, because it's not all about money, it's about having a good lifestyle afterwards.
So avoiding short-term pain going through the surgery, but it may lead to a long-term deterioration of the overall knee joint and shortening the lifespan of the knee.
Correct. And it can shorten their career, not just affect them a decade or more later. They can actually have problems with pain and swelling because the cushion is gone and they overload their joint.
Moving ahead, one exercise every athlete should do for the knee health.
I think the most important exercise is low impact. So we'll tell our athletes that a stationary bike, an elliptical machine, walking or swimming are probably the best things you can do, because you can build up your cardio and keep your cardio up even if you're doing some rehabilitation on the side. So those are the 4 things that we'll go through to try to help build up somebody's strength. No matter what age you are, the stronger your quads are, even if you have osteoarthritis, you're going to function a lot better. So trying to make sure you're in a regular exercise program is probably the most essential thing for these patients that have problems.
Rightfully said, sir. So in short, we have to regularly do the exercises that build muscles around your knee joint, and it should be low impact.
Correct. What I'll usually tell my patients is if they go to see a cardiac doctor, they're going to get a pill. My pill is that they have to work out every day. And I tell them, and it kind of makes sense to them. I'm not going to give them a pill just to mask their symptoms. I want them to get better. And the best way to get better is to be in a regular exercise program.
Right. Moving ahead, one mistake you see repeatedly during rehabilitation process.
Probably the biggest mistake is not doing a rehabilitation.
Oh.
Because if you fall behind early, especially with some of the knee ligament surgeries, you can lose the ability to straighten your knee, or you can lose the ability to bend your knee, and that can lead to long-term problems. And it may mean you need a second surgery because you're not doing the rehabilitation correctly. So following the rehabilitation course and recognizing that early on it's going to be a little bit more sore, but if you work with your therapist, you work with your surgeon, they can help guide you in terms of what is normal soreness, and it's okay to push, versus you shouldn't be doing something because it hurts too much and you could cause some damage to your surgery.
So there has to be a balance between exertion and doing the right amount of exercises.
Correct.
So as not to damage your knee further, and also not slowing the overall rehab process.
Correct. There's some people that will do too much. It's not that often. Most of the time people don't do enough and they end up falling behind or get their knee stiff.
Right. Coming to injections that are very prevalent in India, and people often go to the doctor and asking for injections straight away. One such injection is steroid injection. What's your take on steroid injections? Are they a temporary relief but a long-term evil for the knee? Or in selected patients, we can offer steroid injections, they do wonders?
I think it depends upon what the pathology is a patient has. If they've been doing pretty well until recently and they overdid it and their knee is really sore and swollen and they have some arthritis, the steroid injection, which acts as a local anti-inflammatory, can make the knee quiet down and stop swelling, and they may get back to what their baseline was before they get irritated. I don't think you should have a steroid injection with something to mask the symptoms, but if you have a pathology and it's making your knee have a decrease in function, the steroid injections are a great way for people to put off some of the signs of arthritis. Concurrent with that, they just can't sit back and say, my knee feels better, I don't need to do anything. They should be exercising. So when the steroid injection wears off in a few weeks or months, the baseline strength is better and maybe they won't have the symptoms return.
So we'll put it in this way, that steroid injection does mask these symptoms, but overall it may progress to osteoarthritis if the patient is not very compliant with the physiotherapy and the exercises that he needs to do after the pain has gone.
Correct. You have to take advantage of the fact your knees quiet down so you can get your strength built back up again.
So coming down to PRP injections. ERP injection, as we all know, the blood is taken out from the patient's body, it is filtered, it is processed, and the concentrated platelets are re-injected back into the knee joint. What's your take on that, sir?
I don't use PRP that much. I was involved with a lot of research on PRP initially, and we found out that all the studies I did, it didn't work that well. And I think what it tells to me, it's not that PRP doesn't work, it's just the way that we process the platelets and things like that right now, because there are things that'll make things heal called anabolic, and there's things that'll make it more irritated called catabolic. And we don't know if the time of day makes a difference between the balance in anabolic and catabolic, or if what you eat that day is a difference, or if there's some people have more catabolic ability as opposed to healing ability with anabolic. So we don't really know. And I think that's probably why when we're doing a lot of studies, there isn't a lot of difference between people who have PRP and steroid injections or PRP and even saline injections. And
All right.
And so I think it's a matter of we need more research to probably knock out the bad parts of PRP that some people may have. And that may help us to figure out what is needed to try to address the problem we're looking at.
Moving ahead to one more injection, that is hyaluronic acid. So in India, hyaluronic acid is compared to the grease injection that we put into an engine. So it lubricates the joint well. Also, it replicates the exact mechanism that we already have in a knee joint, that is the synovial fluid. How would you go about that?
So I use hyaluronic acid injections pretty liberally in patients that have osteoarthritis. And it's usually in people that the x-rays look a lot worse than their function. So you're trying to keep them going because they don't have the decrease in function that justifies having a knee replacement yet. They have almost bone-on-bone arthritis, but they can walk 5 miles. So in those patients, just quieting down the knee and having them resume their activity level is important. And I think in my practice, I think it works very well because I'm very selective in who I use it for. But almost all the time, these patients will get 6 or 9 months of relief out of it. So I think it's worthwhile when we do that.
Also, sir, in India, before patient comes to a doctor and is having knee pain, they prefer braces, some sort of splints, drape bandage that they use around their knee joints. Some use it temporarily, some use it for long term. What is your advice to them?
Well, I mean, braces for the right indications are good. A lot of the braces that you can buy, out of a physician's office or a prosthetist's office are mainly there for proprioception. They're sleeves, elastic sleeves, or something similar to that. So it doesn't hurt, but it may not help.
Right.
But people that are bow-legged or knock-kneed and have some arthritis on the inside of their knee, there's unloader braces that biomechanically make sense. If somebody's walking along and they're bow-legged and they have arthritis on the inside and they're putting more weight there are braces that work very well to help unload it and help their symptoms. So I think those are different than the ones that you can buy over the counter, and they're just mainly there to maybe help your proprioception because they're more of an elastic sleeve than anything.
So elastic sleeves that patients use, and they are more or less not helpful, but they can be helpful if the patient perceives it because of the proprioception factor. Also, the patients who have deformity in their knees, like bow legs, or legs going outwards. In those customized braces can be used. They help in offloading the knee joint, mechanically aligning the knee, and further relieving the symptoms. Also, sir, running and marathons are very common in India nowadays. And many runners often feel pain around their knee joint, some in the front of the knee, some in the back of the knee. And also, even on clinical examination and on MRI findings, there is not much significant cause that can be made out. What advice would you give them? What can be the cause of it?
So there are many different things that can cause that pain. The tissue that's behind your kneecap tendon, the patellar tendon, is very sensitive. So we call it the fat pad. And if you pinch your fat pad, or you just, because you're doing repetitive things that your body is kind of breaking down a little bit for, in those circumstances, you're going to have some pain in that area. So I think it's a matter of, you may need to cross train a little more, or maybe you're doing too much of a certain exercise, like knee extension exercises, which can really irritate it. So possibly seeing a sports medicine physician to get the exact diagnosis may help you to avoid getting those irritations.
So in short, a certain form of exercise that the patient or the runner is continuously doing, he needs to reevaluate that. Also, if the symptoms worsen over time, he may just get an opinion from a sports medicine or a sports surgeon to clear his doubts. Also, sir, does running creates an impact when the surface is hard or a soft one? Does this create a long-term impact on the knee joint?
It can, but I don't believe that it's a problem for most people if they're doing it correctly. So shoe wear is important to make sure you have proper shoes. If you have worn out shoes and you're pounding on them, you're going to have more force across your joints. It's also a matter of, how fit you are and your weight. If you're a little bit overweight and you take up running, you're going to put more stress on your knees, and it's not going to be good absorption like we talk about with a physical therapist. So it's a matter of looking at it all together. Running itself I think is good, but you may not have your body ready for running, and you may need to do things to slowly build up for it in a lot of circumstances.
And any one advice that you would give to a Gen Z population that he would start doing from right now so that he preserves his knee joint till he's 70 or 80 years old, and he can do regularly to preserve his knee joint?
I think the things that I see for younger people is making sure you don't put on too much weight so you stress your knee joint, and then making sure you stay active, because it's important for long-term joint health. It's important for long-term brain health that you stay active in a regular basis. So trying to get on a regular exercise program, and like I always tell our trainees, is that you should find a time to work out that doesn't interfere with your family, because you shouldn't be doing it after work when you should be home with your family. So getting up maybe an hour early in the morning and doing your workout then is going to be something you'll appreciate later on when your kids are around and they want to spend time with you because you've been a good dad and you've been there. But I've seen people that finish work, go to the gym for an hour and a half and get home after dinner, and it's not always the best family situation because of it. So you have to take that into account and stay active, but figure out a time that's not going to interfere with your future family or current family.
So one strong message from Dr. LaPrade is to stay active, to take out time, half an hour to 1 hour in your daily schedule, preferably in the morning time, so that your whole day doesn't suffer, your family doesn't suffer. You can give your quality time to your loved ones. So making a habit to add 15 to 20, 30 minutes of daily exercise in your routine will preserve your knee joint, and you will not need a knee replacement in the future, or maybe knee pain. That's about it, sir. Thank you so much, sir. Thank you. And the conversation like these help athletes, sportsperson, young fitness enthusiasts, or the gym goers a lot. And it helps clear their mind and the anxiety that they have, because all of the misinformation that is going all around social media and Instagram and the YouTube, that gives secret mantras to follow, but it is not always patient specific, and people blindly follow them. So I hope people should get more aware of the actual science behind the knee joint and the knee pain, and the correct measures that they can follow early in their life to avoid degeneration.
Well, thank you for the opportunity to talk. I think it was good.
Thank you so much, sir.